Hello everyone, my name is Eme Furahat, an administrator at Marvin Manu Nursing Home. Today I want to discuss about electronic health record system. As you all know, we've been using paper to record patient information, but there is a new system called electronic health record, which will help us more to record patient information electronically. To start, electronic health record system is the one which is computer-based. It's also called electronic medical record. So it's computer-based because records are stored or entered using a computer electronically to mean that there is a use of internet. It's computer-based, so the information can get shared among staffs, among other healthcare providers outside of our practice. So I am going to talk about also two components, include which are clinical care and the administrative care components. So of course they have different components, but also I'll be focusing on only two of them among them. So about clinical decision part, it has a CDS, which stands for Clinical Decision Support. So this system is used to make decisions based on patient care. As some of its functioning parts have updates, information about drugs, medication a patient is allergic to, and some signals identified by a computer due to drug that a patient has been used. So, for instance, a patient if is allergic to any medication, CDS can really find out about that information so that the patient can get another care which is not related to give him or her the same drug which really make him or her allergic. So some of its benefit is that when CDS system is continuously used, that helps to identify potential care to provide to the patient based on medical knowledge identified on him or her. Also, it reduces, of course, medical errors because the more the system is used, the more those medical errors are also avoided or prevented. As a result, a patient can really get a safe health care without making errors because information about him or her is really known. So about its drawbacks is that it is really difficult to identify basic information of a patient who is new at the medicine, at the practice. So it can really take us a long time to identify which care he or she could be get in case he or she is new. So that's how it can affect the staffs at the first time they meet with a new patient at our practice. So another component is called CPOE, which stands for computerized order entry. Actually, it's a component which allows health providers to enter orders, including laboratory tests, drugs, physical therapy, and others, which are entered into a computer instead of recording them on papers. So it's more of a computer management because those information are entered into a computer. So about the benefit is that it helps to avoid medical errors caused by handwriting at the practice because as you know, when recording information papers, maybe they can get lost, maybe they can get destroyed. So that can cause missing of information. So in case we need past history of a patient, we cannot get any information as those information has been get lost. So That's how CPOE helps to record information electronically and even in terms of secure. So another benefit is that it leads to an efficient way in ordering system, as there is no need for staffs or nurses to seek for clarifying or asking for missing information, usually caused by unfinished orders. So, in fact, according to the research done, is mentioned that medical errors get diminished at 55% in case CPOE system is used. So to mean that this really helps much to keep information securely. Also, they can get shared to among staffs in case they want to share information to know to treat or to deal with a patient, uh, even outside of the practice. So that's how it is really important. So some of its drawbacks is that it's about patient private violation, because as information can get shared by more staffs in case they don't pay much attention on patient privacy information, so it can lead to lack of confident confidentiality among staffs, in order they are not that much professional to keep patient privacy information, so they can really violate that rule of keeping those information suffering and even in terms of confidentiality. So that's how CPOE can affect patient in terms of its information, his or her information. So to move on, let me talk about administrative component of electronic health record system. There is patient management component, which is really used to register patients, yeah, at the practice, where a patient is required to have his or her personal information, including names, where he or she lives, the insurance information. So if it is for the first time, we record him using an ID medical record. We give him an ID medical record number. But in case a patient has already registered and come to the hospital, he or she is given another unique encounter number as a proof that he or she used the services of electronic health record system. Hence, these patient management components provide a master patient index. So that that master patient index is given to a patient who is not new at our practice, to mean that he is not the first time he's coming at our practice. So basically, this component, patient management, is used to register patients and dealing with the patients who have already registered to our practice in terms of in electronic way. So he or she must also have a password and an email and password, so that he or she can get access to information electronically while chatting with staffs about the appointment, about the assignment tasks that a staff can allocate to him or her. For instance, some patients are given a task of evaluating their blood pressure levels, so that can really help communication between staff and the patient to know that they are doing the allocated task in order to improve their health. So some of its benefits is that It helps to identify patient addresses so that in case a patient he or she can be needed with some staff for health reasons, it cannot be difficult to find him or her. Some of its drawback is that it requires experience of using it. That can kind of disrupting medical staff, which can really cause low performance in case they have not yet become familiar with registering patients electronically. So to me that this system has to be used by staffs who are experts in it, who have really trained about using it, how to record, to register patients, giving password, giving master patient index. Those are kind of knowledge that have to be that staff has to have in order to work better, to perform better, or to increase their performance at our practice. So it will require time to train the staffs in order to be expert in this field so that they can really increase their performance. So to move on, another part of administrative components of electronic health record is ADT, which stands for Admission, Discharge, Transfer, which actually many people wonder how hospitals keep track of all patients. It is actually done by using ADT, where hospitals automate the tracking process through ADT electronic system. The process helps to track patients who are admitted at the hospital, who are discharged, and even transferred to other hospitals. So basically, it helps to know the inpatients and the outpatients at the practice. So the benefit of this component is to be aware of patients who are being treated at the practice. They can be inpatient, the one who lives in the hospital. They can be outpatients, the others who are treated by the practice but not living in the practice in the nursing home. So this is because it is used to track those who are admitted, discharged, and even transferred. So this really helps to know a number of patients that the practice is dealing with. So about the drawbacks is that it is really expensive as it is done by using computer and experienced staff. Staffs so staffs must be trained before using ADT system, and much money could be spent to implement it at the practice. In fact, it will require us to transform the hardware information into soft ones so that we can track all the patients we have electronically. So there is a need of making sure that the staffs are experienced within this so that some errors cannot be made. So it will really take long for a new practice to get this component installed in it. So to move on, let me discuss about the importance of integrating administrative and clinical areas for effective use of an electronic health record system. Firstly, electronic health record system can help medical practice to become more efficient due to the fact that it helps to use electronic scheduling system where health providers schedule appointments with patients online. Also, it helps in billing system where patients' documentation spontan- spontaneously shows a list of different codes which will be used in billing reasons. As a result, electronic health record system submit the information automatically. Another benefit is about communication, which is very important at any practice. About communication is that it's very easy to record the patient's information as they can be accessible not only online in the office but also outside, to mean that wherever it could be, unless you have internet, and even computer can get access to the information as they have been recorded electronically. Fortunately, this is helpful in emergencies cases, as it is really possible for patients to send a message to the staff, and the practice can allocate tasks to the staff. Then, as a result, staff can work on their task and submit their work electronically. Another benefit is about the improving of care in terms of medical errors reduction. So this is because electronic health record system, within it there are prescribing application which control if healthcare providers offered a prescription which could really activate a reaction which is allergic or not. So this really control how a health physician or doctors are working, how they are, if they are giving prescription, important or appropriate prescription to the patient, so that medical errors can be avoided. Also, it is important because it is different to handwriting system where information cannot get lost, as they are managed electronically, so information cannot get really missed or get lost, as in case electronic health record system is used. So about the benefits of the whole system of electronic health record is that it improves clinical outcomes by improving the quality of provided care. There is a reduction in medical error, as have been discussed, which is also based on the safety of patients. Another benefit is about organization outcome, which includes financial and operational performance, which increases revenues and averted costs. Here, there are the way of increasing revenues by using electronic health record system, where it comes from many sources such as improved charge system, decrease in billing errors or incorrect coding. This is because electronic health record also has has a component of billing system, where the patients who don't use insurances are not pay electronically the fees after getting treated. So they pay by using billing system, which really reduced errors. Also capturing patient charges in a constant way because of that billing system. In fact, 47.48 by the use of electronic health record system, many billion errors or inaccurate coding may have been eliminated, which will increase the cash flow and increase of revenues. About the drawbacks is that if there is really financial issues implement the system into the practice, um, because there is a need of implementing or installing software system, which is an electronic system. So also there is that we will be required to transform hard information into software ones, which is really electronically based, converting hard copies into software ones. It will require to spend much money in for some experts in electronic health records to train our staff, so it is really expensive. In fact, an estimation of a whole cost in 2002 found that only an installation of electronic health record system would cost 19 US dollar 19 million of US dollars in time of only 7 years. So it is really expensive. That's a big issue. And also there is a disruption of working system of health providers, including medical staff, which will be affected by the normal productivity, which may really reduce revenues because, for instance, because the system is new at the start, it will require the staff to be familiar with it, so it will take them time to become experienced about it, so it will really handle or reduce their performance, which will really affect our performance and even the revenue of the medicine, of the practice. Sorry. Thank you so much for your kind attention. I really enjoyed presenting to you about electronic health record. Be aware of it. Feel okay that we will be using it because it will really easy our task. We will be sharing information electronically. We will be communicating easily with the patients. So thank you so much. I hope that we will be using it. We will use it in the upcoming days. So thank you so much for your kind attention. I really enjoyed this presentation with you. So thank you so much.